What's up, Kissables? This is the Kissable Diva. I am your love coach and your date night expert. And you are listening in on the Kissable Nights podcast, where we discuss everything love, sex, and relationships after dark. Well, y'all, this is another show, and we are talking about women's health. Women's health. But first, before we get into that, we have a guest, and her name is Miss Sharonda Hankerson. Thank you so much for coming on to the Kissable Nights podcast.
Thank you.
We're just going to be talking about a little bit of what's going on in the news now. With Miss Felicity Hoffman and Miss Lori Loughlin, they both have been accused of a college admission scam, which is a federal offense, and it's very, very serious. And it is so funny how first of all, it's really funny how it just came out of nowhere. And to me, it looks so sophisticated, to the point where I feel like they've been doing this for years. And those two probably just were the scapegoats. And I'm sure there are many other celebrities that have done the same thing.
I agree.
Yeah. So you, as a mother, would you do that for your child? Would you pay just so that they can have claim that they have education from an Ivy League university?
Absolutely not. I don't think it's fair to the other students. I don't think it would be fair for my child as well. So no, I would not do. I would not pay for my child to be able to get into Ivy League school.
Yeah.
If anything, I would pay for them to have the tutoring and be able to do it on their own.
Right. I totally agree. I would not do that. As I do understand it now, when I look at the movie that Mark Zuckerberg, I forgot the name of the movie, but the movie that basically how he started Facebook.
Okay, yes. Mm-hmm.
So in that movie, I realized that a lot of wealthy families send their children to colleges and universities, or however it is. They send them there to basically network and learn how to run the family business. And
exactly.
It was such an epiphany for me that I was like, I never thought, I thought, me going to college, I'm trying to get a job. And, we're not taught, hey, go to college, network so that you can either start a family business or run the family business. And I just was in awe when I was looking at that movie as to, compared to why I was taught to go to college versus why wealthy children go to college. So, I mean, to have the name of an Ivy League is one thing, but to also be able to go there and hobnob and network and all that kind of stuff is one of the main reasons why they do go to the universities, because ultimately they wouldn't necessarily need it. They wouldn't need the education because they're already wealthy. But I just thought that was so interesting when I saw that movie.
That is interesting.
Yeah.
Yeah, that is pretty interesting.
Yeah. So moving on to other news, Miss Raynell Stewart, also known as Wazam Super, gained her fame through social media. And she started a company called The Cran Case and became a very big cosmetics brand. And she made her first million in November, the Cyber Monday, in 90 minutes.
Wow.
In 90 minutes. And she made her second, she beat her own record, March 1st, with a 40% off sale off the whole site. And she made 1.37 million in less than an hour.
Wow.
So she beat her own record in less than an hour. And not only this superwoman was in labor, having contractions, and she pretty much records everything, because I follow her on Instagram, and she pretty much records everything that she does. I mean, selective, but the big moments. And she
Right.
was sitting there in the hospital, and she was having the contractions while she was signing the contract to her new warehouse for her cosmetic brand, the Crayon Case. And it was
Wow.
a big move for her, and the fact that she is showing that, basically we could do anything. Okay, we
Exactly.
we could do
Exactly.
absolutely anything. So
I agree.
yeah. So did you have any input on that?
Well, I just think that that's really that speaks a lot of volume for her, how dedicated she is to her business, even though she is in labor. But yeah, she's a superwoman. So I think that's really cool.
I think we all are, though. I mean, no, we're
Yes, I
not
agree.
signing contracts in labor, but as women, we handle a lot.
We do.
I mean, children, husband, jobs, house, life
Yep.
itself, dealing with your own self. I mean, it's a lot. And it's amazing how it seems like we are level headed and can keep a level head while doing it.
Yeah, I agree.
So, Sharonda, Miss Hankerson, please introduce yourself to the listeners and let them know who you are.
Okay. Well, my name is Sharonda Hankerson. I am currently a family nurse practitioner. I've been in the healthcare field for several years. I've been a nurse for about 16 years and a family nurse practitioner for almost 2.5 years. So I work in a sort of like an urgent care retail health setting, and I love it. I love all things nursing.
That is so awesome. I love it when someone loves their job.
Mm-hmm.
Oh my goodness, it's the greatest thing ever. You get the best service ever.
I agree.
So, Kissables, today we are going to be talking about women's health, and it's a list of things that contribute to early deaths as far as women go. So, we're just going to talk about 5 of them today. We're just going to do heart disease, breast cancer, ovarian and cervical cancer, gynecological. Oh, say it for me.
Gynecology health.
Thank you. Gynecology. Thank you. Gynecology
Yes.
health and
Mm-hmm.
depression and anxiety. So we're gonna just talk about the symptoms of it and the preventive measures. So that because it is
Okay.
very, very important for you to get yourself checked out. We are super women and we do everything, but you cannot neglect yourself, because if you neglect yourself, then there will be no one left to do everything that you were holding up.
Exactly.
Okay. So, Shonda, could you tell us about heart disease? Like, what are some of the symptoms of heart disease?
Well, some of the symptoms of heart disease would be if a person is having, neck or jaw or shoulder or upper back or stomach discomfort, if they're having shortness of breath, if they're experiencing pain in one or both of their arms. Some people present with nausea and vomiting.
Mm.
Some may have sweating, lightheadedness, or dizziness, or sometimes they just have unusual fatigue. So those would be like the symptoms of someone that's having, this experience in heart disease.
Now, in the line of work that you're in, have you
Mm-hmm.
seen that, like, with your patients that come in?
I have. So some interesting facts is that heart disease is one of the most common deaths for both men and women. And
Mm.
last month we actually had it was go red for women. So in the month of February, we actually have where every Friday women wear red, and it's basically from the American Heart Association, just as a movement or initiative to basically end heart disease and stroke in women and to make them more aware.
Mm-hmm. Mm-hmm. So, what will be like some preventative measures when it comes to paying attention
Well,
to these symptoms?
some of the preventative measures will be to quit or don't start smoking,
Mm.
exercising regularly,
Mm-hmm.
maintaining a healthy weight, and a healthy diet. So a healthy diet would be like a low fat, low sodium diet.
Mm-hmm.
Um, So that would be some of the things that would kind of, that could prevent that.
Okay.
hmm
Moving on to breast cancer. Now, I know that we're supposed to check. At what age are you supposed to check your breast for lumps?
Well, for breast cancer, actually, women should be doing self-breast exams
Mm-hmm.
the time that they are going through puberty. But as far as getting mammograms, the standard age is 40. So at the age of 40, women should receive annual mammograms. Anytime sooner would be for people that basically have a family history, mom or any of the, relatives have had breast cancer, then those may need screening sooner.
Okay. Okay.
Mm-hmm.
That sounds good. So, are there like symptoms, like if you were not checking?
Yes, so there are symptoms of breast cancer. So it would be swelling in part or all of the breast, some skin irritation or dimpling. So it just kind of means it will look kind of like cheese, how it has the dimpling in it. Breast pain. Breast pain is another one. Nipple pain or the nipple turning inward. That would be another symptom. Any redness, scaliness, or thickening of the nipple or breast skin. And a lump in the underarm area.
Wow. Okay. Wow.
Yeah. I also wanted to share some other interesting facts about breast cancer.
Yeah.
Interesting, but of course sad. About 1 in 8 women in the U.S. will develop invasive breast cancer over the course of their lifetime. That's a pretty significant amount, 1 in 8.
Absolutely.
In the year of 2019, the year we're currently in, an estimated 286,000 new cases of breast cancer are expected to be diagnosed in the U.S.
Wow.
So that's a large number.
Yes, it is.
A large number. And about 40,000 women in the U.S. are expected to unfortunately die in 2019 from breast cancer.
Wow.
Yeah, so it's very important to get those mammograms and to do the self-breast screening. A lot of times women find their own lumps because they're doing self-breast exams, go let their doctor know, and then they do mammograms and ultrasound.
So could you possibly describe how you're supposed to do your self-exam?
Well, yes. So breast self-exam, you definitely need to, it's supposed to be done, they said, once a month. Usually, a lot of times people try to remember to do them maybe after their menstrual cycle or like the beginning of the month. And basically, you go in a circular motion, just kind of feeling the breast area. You do it deep. You do it and then you do lightly. Covering the underarm, kind of where the armpit is, you definitely want to go all the way out there.
Okay. Oh, wow. See, I never knew that part of actually going all the way out to where your arm is.
Yes.
That makes sense. Okay. So, moving on, what about ovarian and cervical cancer? Like, what are the types of symptoms that you would see prior to that going in full?
Well, with ovarian cancer, women may have some persistent or like uncomfortable bloating because of where the ovaries sit is kind of in the stomach area. So they may have, persistent or uncomfortable bloating. They may get full very quickly while eating. They may also experience a loss of appetite. They may have pain in their stomach area or feel they need to urinate more, or perhaps even a change in bowel habit.
Oh, okay.
Okay. With ovarian cancer, it's not exactly really clear what the cause could be, but certain factors put more women at risk. So those factors would be smoking, hormone replacement therapy, breastfeeding for less than 6 months, and of course also genetic family history.
Wow, okay.
Yeah, so that's for ovarian. And for cervical, some of the signs and symptoms may be bleeding in between periods, menstrual cycles, bleeding after sex, bleeding after menopause. They may have pain in the pelvis or pain during sex, or just a heavy discharge.
Is it like any type of color or?
Just anything that will be any type of heavy discharge in women. And I know we talk about gynecological health. They should be checked out just to make sure that everything is okay.
Right.
And with with cervical cancer is caused by HPV, that's human papilloma virus.
Mm-hmm.
And what happens is this virus changes the cell in the DNA. Mm-hmm. And in 2008, the HPV vaccine was introduced for girls ages 12 to 13, mm-hmm. and that particular vaccine is supposed to protect them from developing two of the most common types of HPV, which causes 7 in 10 of the cervical cancers.
Wow. Okay.
Mm-hmm. And it could be spread as easily as skin contact. You can get it just from having sex with one partner.
Interesting. Okay.
Mm-hmm. That's for cervical cancer.
Okay, yeah. So what would be some of the preventative measures of that?
Definitely, and this is a little, controversial as far as the getting for the younger girls up to age 26, 27, having them vaccinated with the HPV vaccine is a series. So if they're under 15 when they start, mm-hmm. then they need to have 3 doses. If they're 15 and under, then they need to have 2. So if they're over, if they're 16 all the way to 26, they would need 3 doses. So definitely doing that. And then it's really common for HPV. So using protection could definitely decrease some of the chances, but it can just be skin-to-skin contact.
Wow. I never heard that. Yep. Skin-to-skin contact. Mm-hmm. I never heard that.
Yep.
Wow. Yep. Interesting. So now,
gynecological health.
Seeing a gynecologist, basically, your OBGYN. Mm-hmm. How important is that to see a gynecologist?
It's very important. So, GYNs, that's another name for it, they focus basically on, birth control, so contraceptive health. They mm-hmm. focus on sexually transmitted infections. They focus on breast cancer. They focus on ovarian cancer. They also get the woman set up for, scheduled for a mammogram. They also deal with menopause and hormone therapy. They deal with osteoporosis because as women get older, some of them are at risk for developing osteoporosis. And they also deal with sexual health. So a lot of times as women, we may not know if we're having an issue. Where do we go? Do we go to our primary? Do we go to our GYN? So those are some of the areas that GYNs focus on.
So as Ms. Hickerson has already expressed as to how mm-hmm. it is important and what it is that the gynecologist looks for when you do get a checkup, it's very important because a lot of women don't see the gynecologist. And
exactly.
That's something that's kind of a necessity for you to maintain your health because everything affects something in your body. And, mm-hmm. Because it's all connected. It just is not isolated. So if something is wrong, it's just like a engine to a car. If something is wrong exactly. with a part of the engine, it's going to affect the rest of it or how the car performs. You know what I'm saying?
Exactly.
So you just don't want to just walk around surviving. You want to live to the fullest and highest quality as possible.
Of course, definitely. I totally agree.
So depression and anxiety. A lot of people, I was just speaking with a young lady who I converse with often, and she just had her baby, and mm-hmm. She said that even though she doesn't feel totally down, she's still going through that postpartum. The hormones are still getting back to where they're supposed to be. But it's kind of hard for her husband to understand depression, really.
Exactly. Mm-hmm.
How could you explain to someone who really doesn't understand what depression is or doesn't, because he kind of believes that, it's an excuse for her to act the way that she does, but mm-hmm. how do you explain it to someone who does not really understand what depression is?
Well, depression is definitely a mental illness. So I think a lot of times it's just lack of knowledge. People may feel like they're sad when,
Mm-hmm.
it's actually depression. So the difference would be is if you're just constantly sad. I will go over some of the signs and symptoms, but it's not just like we all have our emotions, but one day we're happy, one day we're sad. That wouldn't be defined as depression, but it would be sort of like a chronic type thing. So depression, usually people have feelings of emptiness or hopelessness, feelings of tension. They may have loss of energy or interest in doing things. All of a sudden, they just don't want to do anything anymore. Some of them have, suicidal thoughts, change in appetite, and that could be as simple as eating too little or eating too much. That is also a sign of depression. Mood swings, sleep disturbance, physical symptoms such as aches and pains. Sometimes people with depression experience aches and pains, and they would never even think of it being, as depression because they're just thinking something's hurting or whatever. Sometimes they have cramps and headaches. But 1 in 8 women experience depression in their lifetime. That's twice the rate as men.
Wow.
Yeah. And depression can come from anything. It can come from our personal or professional lives.
Right.
So it can come from, basically feeling sad, lonely, and scared. Those are normal reactions. So anytime someone gets sad, but it's just they're dealing with it, like some of those signs and symptoms I went over for a period of time, they're probably dealing with depression.
Okay. So, what about anxiety? What about that?
So with anxiety, usually people, the signs and symptoms of that is they feel anxious, they feel nervous, they're on edge. They basically have a sense of impending danger, panic or doom, like they just kind of, feel like the world is coming to an end or something. They usually experience increased heart rate and rapid breathing. They may have sweating, trembling. They may feel tired or weak. They may have difficulty concentrating and trouble sleeping. Sometimes they even have stomach problems, so bloating or maybe dealing with diarrhea and constipation. It could be some anxiety. And basically with treatment for both of those, women can enjoy and improve quality of life. Another thing with anxiety is worrying. Just constantly worrying about something that may not have even happened is definitely another sign of anxiety. And from puberty to age 50, women are nearly twice as likely as men to develop anxiety disorder. So from puberty to 50, age 50.
Wow. So what would be like some preventive measures as far as that? Or like the example I just gave, like how would you, even though that those are the signs, and even though, but how would you, could you, is it possible to explain that to someone or give them some type of example?
Well, I would definitely say that the person experiencing should definitely get professional help. And they could also bring in, if it's a spouse so that they can learn about it too. A lot of times, we just don't know. There's actual thing called health illiteracy. So sometimes you just don't know things. To give you an example, I actually had a friend of mine. Her son was actually telling my daughter that he was feeling sad and depressed. So I told his mom, he was saying he wanted to hurt himself, and her response was, "What is he depressed about? He doesn't have any bills. He doesn't have any," and it's just lack of knowledge of knowing. So sometimes you have to bring that family member in if you're getting counseling or if you're getting some, you have to bring them in so that they can understand.
Awesome. Okay, that's really good. So basically, preventative would be basically educating them on what it is and what to look for.
Pretty much, yes.
Okay. Sounds really good. You did so awesome. Thank you so much.
Thank you.
Thank you. For explaining that. And Kissables, that's just a drop in the bucket, really. I mean, when I looked at the list, I was like, yo, we really can't do all of these in one
Yeah.
episode, but
Right.
it's so much, but it's very, very important to make sure that you keep track of how you feel, how your body works.
Exactly.
Um,
Exactly. Exactly.
and what closing remarks do you have for those that are listening when it comes to women's health?
Don't neglect your health. A lot of time as women, because we're caretakers and we're trying to do it all and take care of family members and work, we put ourselves last. So definitely taking the time off, even if you have to schedule a day off from work and go to different appointments that same day, definitely putting your health first.
Absolutely, I agree. Absolutely. Well, I hope that this show was a little bit on the serious side, but I felt like it was something that was needed, especially women who are always on the go, professional women such as yourself, Sharonda, such as yourself, but you are in the right field, so you already know to take care of yourself. But women who are in this professional field, or that's not necessarily, you're just a mom that's constantly running around and doing things for everyone else, you have to make sure to pay attention to yourself. So,
Oh, yeah.
oh, go ahead.
No, no, no. I was agreeing. I agree with you.
Okay. So, that is the close of this segment. And we're going to go right into date night of the week. So, date night of the week, go to a pick you farm. Just wake up one Saturday or a day that you're off and choose a farm, whether it be apples, blueberries, strawberries, and go to a pick you farm. Have fun, pick as many vegetables or fruit as you would like. Come home and maybe do chocolate covered strawberries, do a fruit salad, include it with your dinner. But that time of actually doing something different and going out to a farm where you're able to pick your own vegetables or your own fruit can be kind of adventurous. That's something different, your date night of the week. Do you have any social media, Sharonda, that you would like anyone to follow?
Sorry, can you hear me? I'm here. I do have my Instagram is at S_HANK123.
Okay. Could you say it one more time for me?
Yes, S like Sam _HANK, and then the numbers 123.
Okay, Kissable. So that is Miss Sharonda Hankinson's Instagram. So if you had any questions or anything additional that you would like to ask her, you can go ahead and follow her right there on Instagram. Y'all, I really appreciate you coming week after week and listening to the Kissable Nights podcast. I hope that you got a wealth of information, because a wealth of information was surely shared this evening. So with that being said, thank you so much for listening to the Kissable Nights podcast. I am your love coach and your date night expert, and you are tuning into the Kissable Nights podcast, where we discuss everything love, sex, and relationships after dark. Thank you so much for listening, and remember to keep it kissable. Peace.